This podcast is going to talk about THET's health partnership model and principles of partnership. These principles are currently thought of as best practice guidelines for health partnerships to work towards when supporting health system strengthening overseas. All the work that THET does is based around the partnership model and supporting health partnerships. A health partnership is a partnership formed between a UK health institution, either a hospital, a trust, a professional association, or a health education facility like a university, and their counterparts overseas. Partnerships may involve two or more partners, but must be between institutions rather than just individuals, although they may be formed as a result of personal connections. The aim of these partnerships is to deliver health worker training and peer-to-peer support through utilising the skills and experiences of each organisation. Partners co-develop programmes that address organisational and national priorities. The partnerships themselves are generally long-term and sustainable, while the projects which they deliver are discrete and tailored to specific identified needs. The aim of all projects is sustainable impact and mutual benefit. So our principles of partnership. Over the years, one of THET's main functions has been to support the partnerships themselves and not just distribute funding. It's not enough just to have a strong project. What we need to have is meaningful, long-lasting and sustainable change. And it's partnerships that survive just beyond a single funding cycle. Partnerships where real relationships between organisations share the same principles and aims. The principles of partnership are what we think will be the key ingredients to strong, effective and equitable partnership. The principles have been developed over the years in conjunction with Southern and Northern partners. These principles of partnership, or as we call them, POPs, are to help improve the quality of the partnerships approach and represent the hallmarks of good practice. They serve as tools and practical resources for both established and new partnerships. There are 9 principles of partnership, all of which more details can be found on the website, along with tools, practical resources and case study examples of how partnerships have achieved the POPs. We're going to talk through the POPs, highlighting a few examples of partnerships who've demonstrated application of the principles, which we think are good examples of them. However, each and one can be unpicked in more detail, and it's worth taking time out to consider the language used and what your partnership understands by it, and that do all members of your partnership have the same understanding of these key phrases. So the first principle we'll look at is strategic. So this principle is outlined by hallmarks of good practice, which you can see on the slide. Hallmarks of good practice are really indicators which we suggest that partnerships probably need to meet to be able to reflect the relevant principle. So here it's having a clear rationale with a formal written document, such as a memorandum of understanding, that partnership plans and objectives are clearly linked to identified needs, that partnerships needs assessments and plans are formally reviewed on a regular basis, and that project activities are prioritised and planned with measurable outcomes. So one example of good practice is the NHS Highland and their partners in Ghana. Their goal was about reducing health harm caused by alcohol in the Upper West region of Ghana. This partnership has been working to reduce health harm caused by alcohol. A needs assessment has the potential to be a dusty document, produced with good intentions and then forgotten. This partnership, however, uses the needs assessment as a process which is continuing and ongoing, evolving over time. This partnership identified the need by talking to the people who will be affected by the project. To do this, members of the UK team went to Ghana to meet with a wide range of stakeholders to hear different perspectives and opinions. And by engaging with local stakeholders from the beginning, the partnership helped to establish local ownership, understanding appropriateness for the project, and establish communication channels between stakeholders. So the next principle of harmonised and aligned includes partnership whose aims and objectives are clearly linked to an identifiable need. Their goals build on and complement the institution's broader strategic aim. There is good buy-in from senior management, and where possible, there is collaboration with other organisations working on similar issues. Some of the most successful partnerships we find are ones which really try and engage with the Ministry of Health in the country in which they are working, along with other partnerships or organisations working in the same space. All too often, there is duplication in work because people don't share learning or explore properly what others are working on. Our example here is the Royal College of General Practitioners, who have a partnership with the Ministry of Health in Sierra Leone. They set out with the aim of increasing the capacity of primary care workers to manage non-communicable diseases in rural areas of Sierra Leone. They were originally partnered with the Ministry of Health and had formed good relations with people working within the ministry. Then there was the election, and those they were working with were replaced by others. The RCGP could have quite easily continued on with the project without trying to build up new relationships. But instead, they waited and patiently began to rebuild relationships with the new people working within the ministry. This was quite a big risk because it meant huge delays to their projects, missing targets and whatever. But it has now meant that the Ministry of Health have signed off the training manual that they have developed in collaboration with others. And there is now the possibility of rolling the training out across the country rather than to just one region that they were originally planning on targeting. So working with the Ministry of Health and ensuring that their work was aligned with national priorities has meant that they're eventually going to have a much bigger impact. The next principle is sustainable and effective. Partnerships that are effective and sustainable involve a large range of stakeholders and ensure continuity and local ownership. They often involve the train-the-trainer approach, ensuring that knowledge is cascaded down. However, as we will see, measuring the impact of this is as important as numbers involved to be able to demonstrate a truly effective and sustainable change. Our example for this is the Royal College of Paediatrics and Child Health partnership with Ola During Hospital in Freetown, again, Sierra Leone. It's an excellent example of how a partnership can be effective and sustainable. This project aims to train paediatric staff to deliver better quality inpatient and outpatient care to neonates, infants and children in Ola During Children's Hospital through the delivery of an ETAT, so emergency triage assessment and treatment plus training courses. THET funded them for 2 years between 2015 and 2017 and then visited the project again in 2018 to see how they were getting on. The scale up and sustainability that was found was truly amazing. And since the end of that project, they've scaled up and are now training nurses in 13 hospitals across Sierra Leone. So 6 UK volunteers pair with 6 of the originally trained nurses, 3 pairs based in the north and 3 in the south, and travel to the hospitals in the region where they're based and train the nurses there to be trainers. Then they support the newly trained trainers to deliver training to both nurses and other health workers in the hospital where they're based. And the aim now is that the UK volunteers scale back and the Sierra Leonean nurses continue the training independently. Part of what made this project so effective is the huge amount of data that they've collected on patient outcomes. And this data shows the impact that the training was having. They shared it with the Ministry of Health, which then therefore got buy-in from them, which then allowed them to scale up so effectively. So the next principle, flexible, resourceful and innovative, is reflected in partnerships who are responsive and adaptive to changing needs. Often partnerships working in challenging environments where change is frequent and unpredictable. And so they need to be able to overcome challenges in a flexible and sometimes innovative way. And this has certainly been noticed in some partnerships over the COVID pandemic. The principle, committed to joint learning, is reflected in partnerships who develop a culture of learning and build monitoring and evaluation systems collaboratively so they can identify what has worked and not worked so well. These systems need to be integrated into your strategic plans really from the outset. And this is something that we're going to support you with during the Health Partnership Capacity Development Project. So the University of York and the Zomba Mental Health Services Partnership, which works to strengthen the system of community mental health care in Zomba District, Malawi, is a good example of this because the partnership made sure to ask questions to all associated stakeholders to involve them in the project from the beginning and initiate joint interest in the development of the project. When the overseas partner noticed some practical difficulties with the speed in which the monitoring and evaluation data gathered as slowing down, the partners asked managers to help with the health surveillance assistance to prioritise the mental health intervention, work within the context of their other work, and the momentum picked up again. The partners listened and respected each other's views and learned from the difficulties met to make necessary changes to the project. So the final principle, Jessie, incorporating a gender equality and social inclusion approach, is reflected in the partnership who conduct a Jessie needs assessment to identify groups at risk of marginalisation, vulnerability and exclusion to targets within their projects. They can also need to include Jessie related activities into sort of planning, delivery and review of programmes, interventions and services to ensure that target groups have equitable access to project benefits, and as well as being able to monitor and explain the differential changes experienced by those groups. So, POPs assessment. We know that stronger partnerships equal stronger projects, and we therefore work with partnerships to identify weaknesses in their partnership or areas that they could strengthen. Once partnerships have identified areas within their partnership which they would like to strengthen, we'll then encourage them to think about ways they can do this, and referring to the hallmarks we've mentioned earlier, and come up with goals that we can work towards to strengthen your partnership and the projects you deliver. So we have developed a tool, a POPs assessment tool, for the health partnership community to support this process. So this slide is just suggesting how it's going to be laid out. And the overarching question is, to what extent do you agree that the 9 principles are embraced in your partnership? So we want you to be guided by the hallmarks, and we'd like you and your partnerships to give a score to each principle with a short reasoning of the score. In terms of a process, we recommend that this is done in conjunction with both members of your partnership. You could either do this as a whole team gathering online, or otherwise as a self-assessment by each partner, followed by a joint review and an agreement of the scores. After the scores are agreed, your partners and yourselves are then invited to prioritise the principles with low scores to guide your development action plan, and which will guide our capacity building planning. So more information about the partnerships, about the POPs and about THET's work is available on our website. And then also I'm putting resources onto the Pulse platform under the group page for the Health Partnership Capacity Development Programme. Thank you very much.